Welcome to the Fusionary Health Podcast. It's me, Dr. Shivani Gupta. I'm so excited to have a special guest on the podcast today, Dr. Branson Collins. Welcome.
Thank you so much. It's a pleasure to be here today.
Oh, I'm so excited that you are here to share with us. I have met you a couple times, and each time I meet you in your office, I learn something new. I'm frantically writing things down. You know, it's so great to meet practitioners who have such deep insights into what we're struggling with our health, how we can approach it, the different tools that are out there that we can kind of interplay with and add in. So I'm excited to dive in today.
As am I.
Awesome. Okay, beautiful. So let's start with your background because people kind of like to framework who they're hearing about, what your background is. So will you share where, what you studied and your background and how it got you to functional medicine?
Absolutely. So I'm an anesthesiologist by training. And I did my training at Rutgers in New Jersey. I decided during anesthesia that I really wanted more longitudinal care with my patients, and I really fell in love with pain management. And even at the time as a fellow, I was really looking into really comprehensive ways to help, really talked a lot about lifestyle, really tried to minimize the use of pharmaceuticals, especially opioids in the patients. Sure. And it was very interventionally focused too, which I felt was very helpful. From there, I had a really influential rotation with a doctor that did regenerative medicine. And he's Dr. Magaziner, that's in New Jersey, a very well-established regenerative medicine doctor. And I was really seeing amazing outcomes with these injections that he would do with things like prolotherapy and PRP. And the patients were just speaking volumes to how much it was helping them. And it was things from migraines to sports injuries, everything you can think of. So what that did for me is it really planted the seed that the body really has an ability to heal itself, which as a child, I always thought that way anyway. And I was always more holistic in my thought process. And what ended up happening was I decided to really practice in the Northwest, and I chose Idaho because it was 50th out of 50th for doctor-to-patient ratio. So I knew that I could do amazing work there. There were only 14 board-certified pain doctors in the entire state, so I knew that I would be very well received. And it also provided really rounding out of the experience of my family to be in the Northwest because we just grew up in New Jersey and amazing things happen over there. So that really led me to getting into more regenerative medicine. But at that time, I was really focused on getting my pain management foundation down. And early on, I was really looking at, okay, how can I do things better? So that brought me to regenerative medicine and ultimately to functional medicine.
Amazing. I have a question for you. When I think of pain management, I thought it's someone who's constantly giving stronger and stronger prescriptions for pain and working with opioids a lot and injections. So it's almost like you chose this profession, but then you were already looking at it as how can I do it differently?
Absolutely. And early on, I was really looking at more of a comprehensive evaluation of patients. So I was noticing associations with things like environmental exposures. People who were exposed to things like water damage in their home. Their pain was really difficult to control. Why did the people with fibromyalgia, with the widespread pain, why did they have thyroid issues and IBS? And was there an association? So I really started digging into that, and it brought me to the American Academy of Anti-Aging Regenerative Medicine. And I made the decision at that point when I looked at their program to really delve into that training. So I did their board certification, and I also did their functional medicine fellowship. And it completely changed the way that I practiced, and I was, in certain ways, reversing chronic pain in many people.
Wow. That's huge. That's really huge. In my experience, it's just I've never seen that pathway. It's really cool to see that, there's so much addiction in this country. There's so much reliance on pain medications. And to that early on, see, wait a minute, there's other factors here. How can we approach this differently? That's a really big message and platform.
It's huge. And it's when I look at where I am right now in my knowledge base for medicine, and it's still early, I'm only, I'm a decade into my career, so I have a long way to go. And when I look at it, I really look at that pain management right now, how it's practiced is very pharmaceutically driven.
Sure.
And when you look at things like drug-induced nutrient depletions, which are common when we give drugs, metformin, for instance, causes B12 deficiency.
Sure.
You have a lot of chronic pain patients that are on 5, 6 different medications.
Sure.
Each one is causing at least 2 nutrient depletions, and those nutrient depletions actually in and of themselves present symptoms. So you look at these things and you start doing nutritional testing, and you objectify these things, you treat it, and you treat the patient personally, and you end up making their outcomes so much better and their side effect profile much better, I mean.
Yeah, what a powerful statement right there. when we take any pharmaceutical drug, there's a likeliness to have nutrition depletions.
Yes.
We have to address those, or those will cause their own symptoms.
Absolutely.
What a powerful reminder. We're not saying pharmaceuticals are bad. We're saying they're very useful in all their purposes. But just be aware of each side effect or issue that they're creating, but then take the time to understand at a nutrient level where you're deficient. I have found that work so powerful these last couple of years. As I've been diving deeper, I've been asking the question, why? Why do I not feel awesome? I do all the work. I exercise, I eat healthy, I source organic. I'm this organic mama who keeps the house as detoxed as I can. We've talked about mold and those things, which we're going to dive into. So like, where are the missing pieces? Where are the leaks? And that was really my question. There must be leaks in the system. Where are they? And I have found that so much of it is nutrition deficiencies, that by being so healthy or so particular in your diet, you can be causing a host of other issues. By not keeping a nutrient variety and nutrient density at the level your body needs, there's issues. So let's kind of dive into that in your functional medicine practice that you have now here in Boca Raton, Florida. Yes. What are some of the big things you're seeing? What are some areas that you specialize in? Like, what do you enjoy diving into with patients, given that you have this background and, you know, you have a patient base that's pretty different being right here?
Absolutely. And there's, Boca Raton's an amazing area, right? So we have a population that tends to be older. Yep. We do have a population that tends to have resources, which is helpful.
Yeah.
What I'm finding in my practice is I'm really finding a lot of people with hormonal imbalances,
sure,
especially cortisol. Right. So if we can get to the root of most, chronic issues for people, a lot of it is driven in the United States, especially in chronic stress.
Yeah.
And what's great about functional medicine is we can objectify that. So, right. So I'll do diurnal cortisol testing, and I'll actually document if somebody's spiking their cortisol and it's causing deleterious effects, or if they're not spiking enough cortisol and they're fatigued and they're tired and they're chasing it with caffeine.
Sure.
Right. So, and on top of that, there's an aspect of looking at autoimmunity of all types. I love treating Hashimoto's and thyroid dysfunction. There's a significant link with Hashimoto's and things like gluten sensitivity.
Sure.
And so identifying those things and figuring out what the triggers are, helping with the gastrointestinal associated issues with that.
Sure.
You can really help to put autoimmunity into remission. And I find it a very beautiful way to practice. Yeah. On top of that, I do see chronic pain and also acute musculoskeletal pain. And I really approach chronic pain from a very integrative standpoint, right? So it's very personalized in everybody that I treat. And it's also looking at a lot of gut health, gut microbiome analysis, nutritional analysis, and then the functional testing, organic acid testing, just getting the data that we need for each particular person, and then creating a treatment plan that's realistic,
sure,
and that can actually help to reverse our underlying issues.
Absolutely. So let's dive into realistic, because a lot of times in functional medicine, I think people have this perception that, like, let's say I'm the patient and I came to you and you'd say, okay, I see that you're complaining about all these issues. Let's do all this testing. People perceive the testing to be very expensive. I think nowadays the prices are coming down. I think it's getting much more affordable, in the range of affordable at least. And then, what's great is when you partner with a practitioner, you're going to help really decide what are those tests we need. We don't need to test everything on earth. And then from there, a plan that's doable, I think, is almost the hardest part, because anytime I'm given a plan, I kind of look at it like, okay, I want to do all that, but I don't know that I can. So how do you work with patients like that?
That's a great question. So one of the ways that I do things, and I chose to move from a private practice realm to more of an academic setting, because it gives me the ability to really treat people as close to cost as possible.
Sure.
Right. So we're not as concerned with the profit margins, because we're a nonprofit organization, and also we're grant funded, which is very helpful by the Marcus Foundation. So one of the things that I really do for people is when I do their intake, a lot of times I call it filling in the gaps. Right. So a lot of times they've seen their primary care provider, maybe another specialist, endocrinologist, et cetera. I'll talk about a case that I got from a referral from the Cleveland Clinic, actually, where I just filled in the gaps and we got the person better. And most of the time when I'm filling in the gaps, I'm just filling in the missing pieces that often aren't considered medical necessity by insurance-based coverage.
Sure.
Right. Things like checking vitamin D status, checking for homocysteine, checking for, these chronic stealth inflammatory markers, right,
sure,
that oftentimes aren't checked. And also doing full thyroid profiles, right, to see if somebody's reversing their active thyroid to make it not bind. So I check all these things, and I can make it very affordable in that way, where I take their labs and then I just fill in the gaps, sometimes for as little as just a couple $100 out of pocket. And then I use that information to really come up with a comprehensive plan, first focused on how can we actually make sure your gut's healthy? Because if your gut's not healthy, it's hard to make anything optimized.
Sure.
It doesn't matter which thing we're talking about, whether it's insulin resistance or a cognitive dysfunction. So I really work to see where they are there and also what's their state of readiness, right? So there's a perfect world and then there's the real world.
True.
And we live in the real world, right?
Yeah.
So, people are working, they're stressed, they're busy, they're executives. So a lot of times I'll focus on their gut, I'll focus on their stress, and I'll make sure their nervous system isn't so sympathetically dominant that they're not able to recover.
Sure.
And then we'll appropriately supplement nutritionally, get them onto a personalized dietary plan, and then I personalize therapies for them, whether it's compounded nutrients, compounded medications, and just follow up longitudinally. And people do amazingly.
Awesome. It's interesting. People assume that to deal with our health in this way is hard. Like I had a client yesterday, we did a consultation and I could tell at the end I left her overwhelmed. And I thought, that's not a good practitioner. If I kind of left you, I said, wait, don't be overwhelmed. It's just a plan. And I kind of realized I like big, complex plans and I like to know the whole plan because I'm just one of those people. I want to know 6 months out, what is the plan? And I can start executing backwards from any given plan. But what you're saying is really so true is we have to see where they are right now. And in this moment of life, I find COVID or pandemic really shifted people's gears over. A lot of people went into this stress mode, and it's really hard to navigate back to who were you pre-March 2020? What was that like? Did we feel different in our bodies? Like, are we new, stressed out people who think we're fine, but we're not fine? So I'm just curious, when you say stress, because it comes up in my own blood work and stool tests. My team sees it very clearly with me right now. How do you guide those patients to change the behavior? Because obviously it's part of their mode.
Yes, that's a great question. And the way I look at things is a couple of ways. One is I think one of the hardest things to change is human behavior.
Sure.
So I actually how I do it is I don't expect them to just suddenly make drastic changes.
Okay.
And to really bring back to your point, how I make my plans is I really look at it from a systems-based approach, right? Okay. So, for instance, if somebody's presenting with immune dysfunction, right? So they have autoimmunity, right? I know that in functional medicine, I'm taught that gut, brain, immune are very intimately tied.
Sure.
So I make a program that really is focused on what's their primary triad that we're dealing with. Right, so it makes it realistic. It makes it so it actually has an endpoint.
Sure.
Along with that, if the gut's involved, a lot of times I'll, instead of doing expensive food sensitivity testing, may just do an elimination diet and see kind of what's driving some of their inflammation.
Sure.
And then before you know it, people are just feeling better because they're eating like whole foods again.
Right.
Right. They're actually getting the phytonutrients they need, the antioxidants they need.
Yeah.
And they're avoiding like refined sugars and refined carbohydrates. And really what's driving, I think, a lot of people when I say stress, a lot of it's the combination of their social stressors.
Sure.
And also their environmental stressors as it relates to do they have clean air? Do they have clean water? And are they eating clean food? Right? It really comes down to those simple things.
Absolutely. Let's dive into that. So, so much of working with functional medicine is investigating. You're like a detective. You're digging into, like you said, filling the gaps. A lot of times people just don't realize what are those environmental factors that are putting stress on their body. So will you educate us a little bit on what those environmental stressors are that we sometimes don't recognize and kind of the punishment or price the body's paying for having those things like mold and these kinds of things around?
Right. So really to start off with, the standard American diet in itself is a very inflammatory diet, right? It tends to be low in antioxidants, high in refined carbohydrates, very overly processed, lots of chemicals and preservatives. And what we're finding is, preservatives, chemicals, for instance, when you put them and you take human cells and you expose them to that, maybe the human cells do fine. But when you expose them to some of the beneficial bacteria in our microbiome, like Lactobacillus bifidobacteria, it kills them, right? So what we're seeing is
it's crazy.
It's very
our own diet will kill our own beneficial bacteria.
Exactly, right? And it's we actually have more microbiome genome in us than human genome, right? So we have to appreciate this interaction, right? There's a reason that we're symbiotic with these organisms. So when it comes to looking at the diet, looking at the microbiome, it's I find that it's very, very helpful and gives a lot of insight. So looking at their diet, make sure if they're eating processed foods, how can we avoid certain processed foods? What can they give up versus what do they need to keep in? And kind of slowly changing that pattern. Usually what happens is they end up feeling better. They feel more energy. They feel like they're not having headaches as much. They're not as fatigued.
Sure.
So I really start there. And then after that, what I end up doing is I really do an assessment too of exposures. A lot of times environmental exposures like poor air quality, where they experience some time in a moldy environment. They currently potentially in a moldy environment.
Sure.
And what we're finding is there's a good amount of literature about how environmental biotoxin, which is mold and even bacteria that's in water damaged buildings, creates a cascade of inflammation that's oftentimes not tested for.
Wow.
And it's driving multi-symptom illness in many people.
Absolutely.
So I screen for those things, and then what I'll do is sometimes I have to really investigate deeper.
Sure.
Sometimes I'm able to really cover for those things just by getting them on a healthy diet, making sure that they're sleeping better, getting some hormones balanced, and they do great. Sure. And other people, you have to dig a little bit deeper and do a little bit more with them to get them better.
I assume mold exposure was like a long 2-year detoxification, horrible process that feels never ending. You're saying sometimes it doesn't have to be that bad?
It doesn't. And when it comes down to it, if somebody's ongoing exposure, it's very challenging. And that's oftentimes when it's prolonged.
Got it.
And I trained under more of Shoemaker's, Dr. Richie Shoemaker's science. And I did that through George Washington University Medical School and did their certification in chronic inflammatory response syndrome. Okay. And it makes sense to me that if somebody is actively exposed to water damage and they're actively living in it, that can you help them with detox? Yes. Can you open up detox pathways? You can.
Yeah.
Can you get them feeling a little bit better by giving them supplements and antioxidants? You can. But if they're in the environment, their ceiling of benefit is diminished.
Sure.
Right?
Sure.
So one of the first things I do is I help them identify with appropriate evaluation of their home.
Okay.
So what you'll see is when people do get their homes evaluated, they do kind of an antiquated way of doing air trapping for spores.
Sure.
Which, if you look at the literature by Shoemaker showed that the spore trapping actually doesn't really have significant clinical evidence or utility in terms of people who are medically ill from it.
Wow.
So what we actually recommend people do is ERMI testing, which actually looks at dust samples. And within the ERMI testing, there's certain scores for people who are medically sensitive versus people who aren't. So I'll assist them with certain environmental specialists that specialize in doing that particular testing.
Got it.
So because if we know that their home is not a trigger, then we can move on for that. But if their home is a trigger, then it really needs to be remediated for them to improve.
Sure. Otherwise, they'll constantly be in a cycle.
100%.
So let me ask about that. When I purchased my home 8-10 years ago, it had mold because we saw it. The kitchen island, the dishwasher had been leaking. The renters didn't really pay attention to it. You could see black mold in there. And I was like, this is it. We can't buy this home. Obviously, we're going to die. And they're like, no, it doesn't have to be that serious. We can contain it. We can remove it. You can replace the island. We'll take it all the way down to the foundation. And then we will remediate. And then you're fine. And I was like, okay, I kind of trust you. I don't really trust you, but okay. So we did that. And then in 2020, I'll never forget, we had a leak from upstairs. We didn't know if it was the roof or the upstairs master bath into downstairs guest bath. And my handyman made a hole. And he's like, I can't see properly, Shivani, can I make a bigger hole? I was like, make any size hole you have to in this house. I always need to know the truth. Because if I know the truth, I can fix it. So he made this big head-size hole. He looks up, and I'll never forget the video he took of a wall of slime. And I thought, we're going to die. We're going to die. I have been put responsible for raising these children, and mold exposure takes 2 years with a functional medicine doctor to detox. What am I going to do? And thankfully, it was so contained. I just sectioned off that whole area, and I kept the children away from it the whole time, and I remediated again. But what you're saying is, a lot of times when we remediate, we're hiring companies and the testing that they're using is just to test for the spores in the air.
Yes.
And that's not the most valid way to test for if it's going to affect our health.
Yes.
So there's a different type of testing.
There's different kind of testing, and there's also different genetic testing to determine if people actually need even more remediation,
Okay.
right? So one of the things that we'll do is we'll do HLA testing to see if they're within that 25% of human beings who, when exposed to mold, what ends up happening is their adaptive immune system doesn't get appropriate handoff from their innate immune system.
Okay.
And what that means is the innate immune system now is just untethered and it's just creating chronic inflammation.
Sure.
And that's actually with just previous exposure. They could actually be out of the environment and they're still inflamed from that previous exposure.
That's horrible. That's any hotel room.
Any hotel room, 50% of buildings in the United States are water damaged. So, flip a coin and, the likelihood is that 50% of the time we're exposed. And the time frame is 4 hours, right? So how many times you've been in a building for 4 hours that you don't know the status?
For sure. A school.
100%.
Yeah, anywhere. Right. So how do we then, because that's like a challenging thing, right? I'm going to be in a lot of buildings. I'm going to be traveling throughout my life. Right. I think having genetic testing and understanding it can be a very powerful piece of data on yourself. I just had one DNA test on myself. I kind of want to test a few. I'm very into data. But based on the test I have and the data I have, I now understand myself better from an exercise standpoint, from a recovery standpoint, from a vitamin deficiency standpoint. So how do you utilize genetic testing with your patients? Because it sounds like Russian roulette that, okay, we're 25% of us are more susceptible and we're all going to be in these moldy buildings potentially in our lives. So it's a two-part question. One, how do we build resilience? Correct. Because we need resilience if we're going to constantly be exposed to things in this lifetime. And then also, how do you use genetics in your practice? Right.
So we'll talk about genetics as it relates to water damage, and then we'll talk about genetics more globally.
Yeah.
So the genetics as it relates to water damage, it's powerful information to know that these particular people likely need to have binders available.
Okay.
For if they're in a building that they don't know the status, they may actually benefit from taking a binder for at least a week after, just to make sure that they're getting rid of the exposure.
Okay.
That may help it so that they're not triggering an immune response.
Okay.
So there's that part. The resiliency part is having a practitioner that actually understands that if somebody is 100% getting better, then there's not much to worry about.
Sure.
Right? But if a lot of people, and especially people that come to see me, tend to be in that 25 percentile.
Yeah.
Where they're just, we've done everything, we've seen a bunch of specialists, we're not getting better.
Sure.
So to be able to actually know what you have to test and go through the stepwise approach to treating it, that's actually what creates resiliency. And I think it's through that education and also through that there is an answer. I think it actually helps to create hope. And
Sure.
also it gives people the resiliency to say, okay, well, I'm actually moving along. I have an answer now to what my underlying complaints are.
Right.
Globally, when it comes to genetic testing, I think genetic testing is very useful. I think that it's really useful because DNA is like the hard drive, right? So it's like the hard drive of a computer. We need to know what that hard drive is doing, what it's predisposed to. But then how do we actually modulate that DNA with epigenetics, right? And I think that's really the key in where we can influence things is we can actually put the DNA into a status where it's actually expressing the genes we want and not expressing the genes we don't want.
Sure.
So one of the things I'll look into, and I really approach this status with, is nutritional immunomodulation.
Sure.
So I'll make sure that I'm doing personalized, low inflammatory for the person, high in antioxidants, and also really give them nutrients that actually help that genetic expression to be positive for them.
Sure.
And that's just the diet part. Of course, there's the lifestyle, the stress reduction. What are you doing from a spirituality standpoint? I mean, it has to be comprehensive and it has to be very personalized.
Sure, absolutely. When it comes to mold, that's one big environmental toxin. I kind of feel like our bodies are under assault. Like, that's really how I think of it. If you follow me on Facebook or Instagram, sometimes I just go nuts and share everything I see. And maybe the algorithms know me well, so they know I'm constantly reading about this topic. But I feel like our water's polluted, our air quality is not good, indoors or outdoors. Indoors, if we're using, chemical, like traditional cleaning products, we've got problems. If we're storing our food in plastic or heating it in plastic or using the microwave, it's a problem. So like the issues stack up. So when people meet me, they're usually like, oh my God, like how do you do all this? I pan heat my food in stainless steel. I don't let anyone use the microwave. So kind of how do you guide people towards understanding how these things kind of stack up? Because in my opinion, it's almost like if the body is constantly triggered, having inflammation and struggling, then it's just a matter of time before something sets off a cascade of events. Could be a huge stressful life event, could be anything. So what have you kind of seen helps people, and how do you approach it?
Right. So along with that, there's this concept of allostatic load, right? So each individual person has a threshold of stressors they can tolerate, right? So it doesn't matter the stressor. Sometimes it's childhood trauma. Sometimes it's environmental exposures, right? Infections, right? And stealth infections and infections from childhood, right? So we actually each have a threshold. So I think part of it is knowing that how can we peel back those metabolic layers, right? We're all going to be exposed to things, right? How do we actually build that resiliency to make it so that we can actually tolerate? So that's why clean, healthy diet is important.
Sure.
That's why hydration is important, right? That's why sweating is important. So I'll do things like some people do really well with infrared sauna, right? If people aren't exercising, getting into an exercise program that actually is personalized, realistic, and moderate in intensity. It doesn't necessarily have to be super intense for an hour, right? And a lot of times, if somebody's stressed out and they're high cortisol, the last thing you want them to do is high intensity interval training.
Yeah.
Right? So really personalizing the treatment plan to that. And also we can do functional testing to really identify, okay, well, what are the major sources of toxins in this particular person?
Sure.
Right? So is it microplastics, right? Educating, okay, if you're going to microwave, which I don't recommend necessarily, don't microwave plastic,
sure.
Right? If you have a plastic bottle, which I have a plastic bottle here today, try not to have it in the environment where it's outside getting heated,
sure.
Right? So little things like that help with that burden, and then understanding that each individual person has different genetics for how they can get rid of toxins,
sure.
And you can do functional testing to see what their phase 1, phase 2 detox capacity is. Right. You can give them supplements like glutathione. Yeah. I love N-acetylcysteine to help support that and convert to glutathione. IV therapy can be really helpful.
Absolutely.
But I really work on the pillars of foundation where it's, if we can get the gut healthy, if we can get them eating right, if we can get them fiber in their diet, eliminating, not constipated, not having diarrhea.
Absolutely.
It helps them tolerate toxins better.
Sure. So it's really that Ayurvedic message as well of build the gut, get that strength and resiliency in there. Everything else will be better. We can't promise everything will get better, but in a sense, you're investing in that resilience. Then you have that strength to deal with everything else.
100%.
Yeah, that's awesome. So what are some of the favorite products or things you've used with patients that you wanted to share? Is there anything that you're into? Because I know every time I talk to you, I'm like, what are you using? What do you think about this? Do you have a product for that? Because as functional medicine practitioners, what I love is you guys are detectives, but you're also explorers. You're constantly testing different things. I'm the founder of a company, so I love, talking to you guys and saying, have you tried it on a patient? What did you see? Did you see it in the blood work? So to me, you're such powerful knowledge bases of cool things that are out there that work.
Absolutely.
Yeah.
So one of the things that I really find is right now, as a functional medicine specialist, I'm really an inflammation specialist.
Sure.
And if you look at most chronic diseases, they're linked to inflammation. So I like to really look for things that actually help mitigate inflammation and help reset that, right? So one of the things that I actually have been using a great deal of with great success is the Prolon 5-day fasting mimicking diet.
I've heard about it and I've been wanting to try it. Will you share with us about it? Because it seems like a lot of my practitioners, ambassadors are very into it. Right.
So what I love about it is that it's rooted in science, right? So Dr. Longo out of USC, longevity, specialist really focused on, why do species live longer, right? And what we've known this for a long time across species, that species live longer when they have decreased caloric intake.
Absolutely.
So
easier said than done.
Easier said than done, especially in American culture, right? Where we're overfed and undernourished.
Sure.
So what they found in their studies is that they ended up creating a program that you're getting nutrients, which is important, and you're getting calories, but you're actually in a fasting state by day 2.
Wow.
And what's important about that is this concept of cellular senescence. Right. So when people are inflamed, some of their cells, you'll go into this state of almost arrest where they get put on pause. And what we found with this cellular senescence is that these cells are not just not utilizing energy, they're sometimes sending aberrant signaling, they are utilizing energy, and they're not really being productive for the entire system.
Sure.
And you can imagine over time that, just as we discussed, as these layers of toxins build up, maybe more cells become senescent, and before you know it, somebody's having cognitive dysfunction, they're forgetting their keys, and then it just leads to this cascade, and then 30 years later they have Alzheimer's.
Sure.
So what they found with this program is if you formulate the calories in a certain way and macros a certain way, not only does it improve stem cell regeneration, which they actually have evidence for.
Wow.
It also decreases metabolic inflammation, improves insulin resistance, it decreases visceral adiposity.
Amazing.
Decreases CRP.
Okay.
And so systemic inflammation there. And it actually works to actually help with this concept of autophagy to make sure and to get the mitochondria functioning again, the cellular energy functioning again. And the biggest evidence for it is that you do it 3 months in a row.
Okay.
5 days, month 1, 25 days, hopefully an anti-inflammatory diet. But the evidence doesn't say you have to do that. You go back to your usual eating plan, 5 days again, month 2, 5 days again, month 3.
Okay.
It actually improves your metabolism for the entire year.
Wow.
So people do get weight loss. They do get some resetting of that cortisol, insulin kind of spike that happens,
Sure.
which a lot of times is what drives food cravings and what that stress response.
Right.
So I've had really good success with it, and I'll discuss later on a patient that I actually utilized that in. There was a chronic pain patient, and that was kind of I'd done a lot of foundational things for him prior to that.
Sure.
But the adding in the Prolon is ultimately what gave him that extra push to decrease his pain by 50%.
Really? Yeah, dive into that, please, because, a lot of us think about intermittent fasting. A lot of people are trying it out. I'm reading so much about how men and women are different, and we cannot, as women, hold the same intermittent fast all month. We have to understand the cycle of the month. And it's just interesting because I always watch fads come through. And in Ayurveda, we believe in moderation. And so every fad that comes through, I'm willing to try anything. It's not like intermittent fasting is not part of Ayurveda. In Ayurvedic wisdom, we always said, take a day a week and fast, clear the system. You're talking about cellular senescence. You're talking about autophagy. Our listeners might not have heard of those words, so we're going to have to explain those a little bit. But it's almost like, can we just clear the deck? Can we just do that deep cleaning of the house, get everything that doesn't need to be there, the cobwebs and dust out, so we have a clean slate?
Exactly.
And another thought process I have around that is I always say that when I have excess fat on my body, I always think of it as its own separate entity. I'm like, oh, is that just xanthan gum and all the processed ingredients from my gluten-free foods being stored in some part of my body because my body just doesn't know what to do with them until I do a proper detox and set myself up to remove those? Are they just having their own little mind going in their own direction that's separate from my own individual agenda?
Interesting.
So can you talk about that a little?
Yes. So on one hand, what we do know about these, the visceral fat, the fat around the organs, is actually very metabolically active, and it actually creates chronic low-grade inflammation. So it also leads to insulin resistance, and insulin resistance leads to poor energy, poor cellular energy, and also is a risk factor for neurodegenerative and dysfunction, and also cardiovascular disease. So along with that, it's really important that we give our bodies time to clean up the cellular debris, right? Because our cells are undergoing processes constantly. And part of those processes is deciding, okay, cell, are you being productive?
Right.
Are you not being productive? And if we're not being productive, then, okay, we're going to do something called apoptosis. The cell's going to die, and we're going to divide some new cells, and this one's going to be healthy, and then we're going to actually have a nice, fruitful, homeostatic, balanced system, right?
Exactly.
In a perfect world.
Yeah.
Right? So what ends up happening with fasting and with these concepts is one of the things that I'm finding in this fad is that everybody doesn't tolerate intermittent fasting.
Right.
A 16-hour fast may be tolerated by some, but not by others.
Correct.
Right? So what we're seeing is when people do prolonged intermittent fasting, and I had one client who was a naturopath, that she was actually one of the earlier practitioners in functional medicine. She'd been practicing for 30 plus years. So she was very, very regimented.
Sure.
She was taking all the supplements. She was, prescribing things like growth hormone before it was even popular, right?
Yeah.
And she had been doing intermittent fasting for about 30 years. And she developed this neuropathy and this almost this chronic regional pain syndrome, where it's just swelling in her lower extremities, pain, vasomotor symptoms, and it was very debilitating. She ends up seeing me, and I get the history. I'm like, well, lifestyle's kind of perfect.
Yeah.
In retrospect, maybe doing a little bit too much. Like she was working out 7 days a week with a trainer. She's pushing. So certainly she's high cortisol and maybe doing a little bit overtraining.
Sure.
But I actually did a NutriVal for her, which I love that test because it looks at, it breaks things down and looks at intracellular nutritional analysis, organic acids, so you can get a good kind of overview of microbiome, neurotransmitters, et cetera, even heavy metals. And just her general test, she showed transaminitis, so her liver enzymes were sky high. Okay. Like, why are her liver enzymes sky high? And what we're finding is prolonged fasting, especially in women, actually puts stress on the liver, and because you're breaking down your glycogen stores, actually start putting stress on the hepatocellular cells. Okay. And with that, detox actually goes in a negative way. Sure. And people become more inflamed. Wow. So that's why I think it's very important when people are doing fasting that they're with a practitioner who understands fasting, that actually has their numbers looked at so they can see, okay, is this fast working well for your system? Or are you somebody that actually needs to just do a 12-hour fast and go with that?
Yeah, it's such a powerful statement. Sometimes every health fad that comes along is not for you. Sometimes these trends that come up, and everyone is talking about the science of fasting right now. Circadian rhythm is coming up as a conversation as well. These all were part of Ayurvedic medicine 5,000 years ago. We always said by 7 o'clock, finish dinner. By 7 a.m., then after that, you can have breakfast. Like, keep the 12-hour fast. If you want to do your yoga, meditation, and healthy self-care practices in the morning, fine. You can push that a little farther. But hold that time period as an honoring of gut needs to rest. Let that digestive system rest so the body can clean and clear, lymphatic system, inflammation overnight. But it's just, I intuitively, from Ayurveda, really ask people to look at themselves and think, is this right for me? So I've tried fasting. I try to hold till noon. If I structure it right, I can. But I could tell in my body, for the level of mental and energetic capacity I'm trying to run every day, there's no point stripping out my body from the inside. Like it's almost like, yes, it's a healthy thing, but it's not healthy for me. And so I love that you're sharing that. This is a person who is so into their health. I have a tendency to go overboard, and I'm a pitta dosha, so I have to watch how much I go into the health practices that I love. I try not to overtrain and all, but when it comes to anything in the body, good might not be good for you. So really personalizing with someone like you and saying, hey, I actually know from my genetic testing right now, I'm not actually supported in detoxing. So I have to sit there and look at what are the practices I'm doing that are harmful as opposed to helpful, just because they're touted as good.
Exactly. And there's something, the wisdom of things like Ayurvedic medicine. You look at Chinese medicine, and you look at the wisdom of thousands of years. We have to appreciate that. And we've moved along in the United States where we've become very pharmaceutically driven, and we've kind of moved away from this more holistic, ancestral way that we've practiced. The way that I look at things is, we wouldn't be here as a human race without plants, without herbs, right? Yeah. There weren't pharmaceutical companies, 1000 AD, right? True. So for some reason we're here. So along with that, what we have to appreciate is our ancestors, we'll just say we're perfectly designed, right? Meaning that they've passed along their genome to us in a way that has been beneficial for survival of the species. Right. So why is a 12-hour fast better for most people? Well, we tend to run on a circadian rhythm where the sun goes up and the sun goes down. Correct. Right? We're not, our ancestors likely weren't eating late at nighttime and 2 a.m, right? Because they're up at call and internal medicine, and there's, they just did a crash case, and now they have to feed their cortisol, right? So I think there's something to appreciating, why our ancestors allowed us to be here. And that's why things like the paleo diet have become popular,
Sure.
right? Because if we look at how our ancestors were eating, they were eating whole foods.
Right.
They were eating organically,
Yeah.
right? And they actually weren't consuming a lot of calories. And there's this other concept I want to talk about winter metabolism and summer metabolism.
Sure.
Right? So the winter metabolism of things is we're in an area where it's cold in the winter.
Yeah.
Food is a lot more scarce, and people fasted more then, and part of that, they got into this winter metabolism.
Sure.
Their cell survival genes turned on. They actually started holding on to energy.
Yeah.
Right. The challenge is when we have this summer metabolism, it's robust, bountiful, foods everywhere.
Sure.
Right. In the United States, we eat with this summer metabolism
Year round.
Year round.
Yeah.
Right.
It's
And
true.
we're not appreciating that there's this season of eating. Right. Seasonal vegetables, like seasonal.
True.
All of it, like in appreciating that some people eat the same things all the time, right?
Totally.
But they're not eating what the land would be providing at that time, which there's a reason that all these things have gone through these cycles. And I think appreciating that cycle is part of what I try to do when I help myself and my family, but also when I'm taking care of my clients.
Sure. Will you share some of those unique patient stories? I always love hearing those because they illustrate so powerfully why it's important to partner with a functional medicine practitioner to seek out those results that we want in our health. I meet so many women right now, and I have for over a decade. I call it preclinical, like subclinical thyroid condition. So many women are suffering low energy, brain fog, and they're like, well, my endocrinologist said it's not Hashimoto's and I don't need a drug yet, so I guess I just have to wait. And I'm like, you just have to wait? You're waiting for this gate that you don't even want to open? What about prevention? Then there's perimenopause. I'm 42, so my whole crew is up in arms over perimenopause. Up ahead, all my friends, menopause. And so there's all these transitions. And then there's on top of it, as the founder of Fusionary, and we can dive into inflammation in my products briefly, I see so many people in pain, chronic pain, joint pain, rheumatoid arthritis, osteoarthritis. I see people suffering. And so I'm just curious if you can share some patient stories because I love hearing those.
Sure. So I'll start with, as you were discussing with the subclinical hypothyroidism, how about let's talk about kind of overt Hashimoto's hypothyroidism, right? So I had this referral from Cleveland Clinic. It was a patient that had seen multiple practitioners, and they could not get her thyroid under control, right? So they had her on traditional levothyroxine, which most people don't know that levothyroxine, by evidence, only works in about 20% of individuals. The question is why, right? So 80%.
That's insane.
It is, and 80% of the time, it's not very effective for people. So there's a couple of reasons for that. So
no wonder my friends are complaining. Thank you for validating why.
So she was on levothyroxine. Her TSH is just, I think it was as high as 16, where ideally it's between 1 to 2. Most reference ranges, let's call it 4.7 is upper range, right? So she's tired, she's depressed, she's losing hope. And she's very inflamed. And she had a background history of having some eating disorder when she was younger in her teenage years, which certainly likely played a role in chronic stressors early on, poor nutrition early on.
Sure.
So when I evaluated her thyroid antibodies were in the thousands. And for most thyroid antibodies, my thought is you don't want any thyroid antibodies. You don't want to be creating antibodies to self, but most reference ranges will say, if you have less than 5 or less than 1, that's, normal curve.
Sure.
So, to say that she's in the thousands, she's certainly inflamed, right?
Yeah.
So one of the things that oftentimes is fill in the gap is people aren't evaluating people's adrenal response.
Right.
And that's one of the things that we know in functional medicine is if you don't control somebody's adrenals, their thyroid is going to be all over the place. So this was kind of low-hanging fruit for me, right? So I did a diurnal cortisol testing, salivary, 4-point cortisol. I did a more robust thyroid testing, looking at things like reverse T3 to see, which is looks at are the mitochondria working well? Are there cortisol issues, and are they converting their T4, which is the inactive form, to a form that is not active and also is binding against the receptor, right? So she had elevations of reverse T3, which are not good. right? She was, her T4 was still low despite being on levothyroxine. So when I got the testing back, first thing I did was I really said, okay, what can we do about your gut and diet?
Sure.
So along with that, I got her into a low inflammatory diet. I got her off of gluten.
Okay.
One of the important things when it comes to Hashimoto's is one of the mechanisms that gluten may be playing a role is that when people consume gluten, on one hand, in the United States, the wheat is full of chemicals.
Yep.
Right? So glyphosate is destroying the microbiome. It's causing a good amount of issues. It's outlawed in other parts of the world.
Sure.
We're still using it.
Yep, which is crazy.
So it's not necessarily the gluten that's bad for people. Sometimes it's the chemicals, right?
Right.
But what ends up happening is gluten increases the GI permeability.
Right.
And what do we have inside of our colon? We have stool, we have undigested food particles, we have bacteria.
Right.
What is our immune system primed to look at and identify? Oh, bacteria, I'm going to tag you, right? So one of the mechanisms of Hashimoto's is that this undigested food particles and also the coding of these gram-negative bacteria, it's called lipopolysaccharide, actually gets tagged by the immune system when it goes through these GI permeability and the actual receptors on the thyroid. So that's actually what leads to Hashimoto's.
Leaky gut.
Wow. So I worked on her gut. I got her on L-glutamine, which is helpful for that. Got her on a low inflammatory diet. Her cortisol showed elevations in nighttime cortisol, which is the most deleterious. One of the things that nighttime cortisol elevations does is it increases a cytokine called IL-17. Cytokines are these signaling molecules that, some are, inflammation can be good and beneficial, but some inflammation when imbalanced is not good. IL-17 is linked to autoimmunity, right? So I got her onto a supplement called phosphatidylserine. Phosphatidylserine has shown evidence in cognitive health. It has evidence in Parkinson's, Alzheimer's, and also it helps to curb nighttime cortisol.
Okay.
So I got her onto that. I got her into that prolonged 5-day fasting mimicking diet to give her a metabolic reset.
Sure.
Within 6 weeks, the next visit, she's like, I feel like I'm changing in a good way. I haven't felt like this in years.
Wow.
Right. And, fast forward to the next month, you know what? I'm starting to feel better. I'm going to start doing some infrared sauna. So she starts just doing these wellness things.
Yeah.
She starts doing the infrared sauna a few times a day, bought one.
Wow.
So now she's opening up her detox.
Sure.
And she's just, I get her onto some support nutritionally. I get her onto some adaptogenic support additionally. Yeah. And lo and behold, I get her labs back and her thyroid's completely normal.
Wow.
She's feeling the best she's had in years. And she's like, the interesting part about that case is when I first saw her, her biggest compliment to me was, thanks for listening and believing me. Right? She was like, I've seen so many practitioners that they act like they don't know what's happening with me and they're discounting me. Yeah. She's like, you didn't discount me. I was like, well, I've heard your story before and what you're saying makes complete sense to me and I know how to approach it. Yeah. Right. So that was a major win. I love that case. And she's still, the great part about this is when you're following up with people, functional medicine, you can transition from taking care of, an underlying disease state, let's call it, or chronic illness state, to just doing wellness, right? So now we're just doing wellness,
right?
Which is great, and that's a forever thing.
Check in and say, "Wow, you're feeling amazing."
Right.
What would you like? Would you like to go further? Would you like to optimize anything now? But you're already in that healed state,
right? And she does have things like osteoporosis, and she's postmenopausal. So there are some things that ideally would have been done early on, with things like bioidentical hormone replacement therapy, which could be helpful for that. Sure. But we're working on some wellness things there.
Awesome.
So that's one great case that I love to think about. And
it's a big one. The level of women struggling with thyroid issues and imbalances and suffering, and I'm learning so much about this. I just had the Dutch test done on me, and I knew when I got my fibroid in 2018 and had to surgically remove it because it was like a dragon's egg. It was 10 centimeters. I knew. I said to myself from the inside, I was like, Shvani, you're obviously estrogen dominant. I bet you have no progesterone. But only now, like in the last 3 months, did I get a test back, and it confirmed my belief from the inside, which was I have the progesterone of a postmenopausal woman, and I'm 42. It makes no sense. So I could just keep going the way I am, or I could take time to pause and say, why is something not working right with me? What is going on? Why am I creating a foreign body in my body? If I want to never do that again, what are the actions I'm going to take to get the data I need to proceed differently? And then, you have choices, but you need to be under the care of someone who can guide you safely in that.
Absolutely, and it's very important to build a relationship with a practitioner like that, because we're still living beings that have lives, right? Yeah. Things still happen, right? And things are never going to be perfect, but can we kind of go through those ups and downs and improve things so that we're feeling resilient and we can deal with those stressors that happen, and we deal with them in a way that we're taking them in stride.
Yeah.
So. The second case I wanted to talk about is a chronic pain case. And this is originally what made me fall in love with functional medicine. When I started implementing functional medicine principles into chronic pain, things like looking at nutritional deficiencies, identifying inflammatory diets, or even doing elimination diets to make sure people didn't have food allergies contributing to things like chronic joint pain. This case really is a hallmark of that. So I have this patient who 5+ years on opioid therapy for chronic thoracic back pain. So his mid-back just so debilitating that he's on up to 5 hydrocodone a day. He's getting taken care of by a local pain management doctor.
Wow.
He's tried and failed injections of the small joints, injections into the space where the nerves are. He's failed even regenerative therapies, which I do want to discuss. This is the magic of where regenerative medicine meets integrative medicine, because most people don't know both. So, but let me keep with this case. Yeah. So when he sees our practitioner that does osteopathic manipulations, it's helping, but he's still requiring hydrocodone. He's an executive. He runs his own business, and he's just stressed out, and he's feeling like his functional status and his quality of life is poor. Sure. So I see him and I fill in the gaps, and the interesting part is his thyroid testing from his primary looked normal. They checked his CBC, his bone marrow, his renal function. Everything looks normal. So I said, okay, let me see what happens when we check his insulin. Sure. So fasting insulin should be less than 4, right? Less than 6. His was 96. Wow. Right. So he's insulin resistant and inflamed. His high sensitive CRP, which also wasn't checked, should be ideally less than 1. And his was actually 6. His B vitamin metabolism, so his B vitamins weren't optimized. And one of the things I look at there is homocysteine. Why? Because when homocysteine is elevated, the brain's inflamed, the cardiovascular system's inflamed. And if we think about that, our oxygen needs to be transferred to our tissues. If our vascular system's inflamed, we're not transferring oxygen well, right? So that's not helping things at all, right? So, and the other part is that I screened him and found out you likely have undiagnosed sleep apnea.
Big one.
Huge. And not only is undiagnosed sleep apnea, is it under-recognized, but it also drives autoimmunity.
Absolutely. And inflammation.
And inflammation, right? And it was one of the biggest things I looked at as a chronic pain specialist was, does this person have sleep apnea? Wow. And I can't tell you how many people, especially with chronic neck pain, headaches, that they had sleep apnea, and their pain reversed when we identified that. Wow. So I did hormonal testing on him. I did his cortisol testing, which certified, and he had that pattern of somebody who has sleep apnea. He was high cortisol at night. I also used phosphatidylserine for him. I put him onto there's a metagenics product called Insinase, which actually works to actually improve insulin response. Okay. So I got him onto that. High quality fish oil just to help with his inflammation. Sure. I also got him onto the inflammation relief formula. Oh, awesome. And because I knew he needed that with his chronic pain. Sure. And I also had him evaluated with a sleep study. Okay. So got the sleep study, identified his sleep apnea. We got him, he actually couldn't tolerate the CPAP, unfortunately, so he did an oral device instead. And this is also somebody that as we were moving along, second visit, still feeling about the same. Okay. Third visit, feeling a little bit better, but I'm getting pill fatigue. Yeah. Too many supplements. And I try to be very cognizant about not just, recommending 30 plus supplements, but he was getting pill fatigue. So I kind of, although there were other things I could give him, I said, okay, let me just kind of pull back a little bit. One of the things I did for him too is I did a certification with American Academy of Anti-Aging Regenerative Medicine in peptides. Okay. Awesome. And, peptides got very popular, especially during the pandemic. Sure. And really, peptides are signaling molecules that there's different peptides that have different effects. Like some peptides help with insulin response.
Sure.
Right? Or at least we see an insulin change with them, right? Other peptides are good for inflammation, right? So I got him onto a peptide called BPC-157, which is stands for body protective complex, which has significant literature showing improvement with inflammation and also with pain.
Okay.
So I actually got him taking that, and then I put him onto the Prolon 5-day fasting mimicking diet. By month 4, his pain is 50% reduced.
Wow.
He's cut his hydrocodone down by 50%.
Nice.
And he feels like his life has changed already. And he's like, and he actually thought it was, he said to me, I can't believe all I needed was the fast. And I was like, well, we did a little bit more than just the Prolon.
Yeah.
But whatever you think helped,
Sure.
helped. And that was just with his first Prolon. He didn't even get to the second and third yet.
Okay.
Right. To the point where he went to my colleague that had been taking care of him with OMT for many years. And she's like, I've known this guy for 7 years.
Yeah.
You meet him for 3 months and his pain's 50% improved. And I'm like, well, I was like, we did it together, right?
Yeah.
It's you listen to the patient, identify that there's metabolic factors playing a role even in chronic pain.
Sure.
And it's starting to become popular now that metabolic inflammation is leading to, cardiovascular disease and Alzheimer's. Metabolic inflammation is leading to chronic pain, folks.
Sure.
Right? And if we can identify the metabolic components, we're peeling back the onion now, right? So with getting somebody's homocysteine better with B vitamin support, getting their sympathetic nervous system toned down,
Yep.
getting them detoxed, where one of the things I'm seeing in opioid therapy is people build up, that's another toxic burden
Wow.
source now, right?
Sure.
So maybe they are exposed to poor air quality. Now they're exposed to acetaminophen, which is depleting their glutathione.
Sure.
Right? Now they're exposed to opioids, which is another toxin.
Right.
And now they're just not detoxifying. They start feeling worse when initially they may have felt well in these kind of regimens.
Right.
So that was a great case too, because I was concerned that opioids in them themselves are kind of their own animal in because of how they're designed and how they're metabolized. Yeah. Sometimes people end up having chronic pain or pain show up in between dosing. And we saw that with OxyContin.
Okay.
People were actually experiencing, a lower plasma level of the OxyContin, and actually their pain was coming back because they were really withdrawing.
Sure.
So it's one of those things where with him, I was concerned that the opioid was contributing to some of his pain.
Right.
And I still think it may be. But we got a 50% improvement just working on his metabolism, improving his gut, and getting him on some nutritional support.
That's a big deal. It's a big shift to take someone's pain and cut it to half. I have had phone calls from people who say, hey, can I take your turmeric? I'm taking all these opioids. And I go, no, I am not promising a darn thing to you, because what you're taking is like taking an elephant level support, and turmeric is very powerful. We're going to address that root cause, but there's no equivalent here. Like I cannot promise any result, because I know that the conversation is much bigger, like what you're talking about. It's understanding so much more, and then step by step walking down that journey. And then yes, the fasting worked, but it worked because you had done so much setup, you had already supported the body in all those ways, already reduced inflammation from so many different directions.
Right.
And I see that with opioid use as well. We have an orthopedic practice who uses my inflammation relief and turmeric gold. They were able to cut their opioid use in half post-op, which is a huge metric to me. If we're not giving people so many pharmaceuticals, they don't have those toxic burdens, and then they don't have that punishment related to it in the long term.
Right, exactly.
Yeah.
And what I find and what's very interesting with these kind of treatments is the whole push for people using things like stem cell therapy and plasma-rich platelet therapy to heal themselves. One of the things that I found in my practice is that if people are metabolically inflamed, and then you take their stem cell out and you give it back to them, what kind of result are they going to have? What kind of result do we expect? So is that a reason that people have failures when if you work on the metabolic inflammation first,
right,
and then you actually extract a stem cell, or you extract their blood and spin it down to PRP, then put it into a tissue area that's injured, that's when the magic happens. And
sure.
and I've seen it firsthand with my practice that I like to, and I've done it for a decade now, where you get people's metabolic inflammation improved, and then you intervene with an intervention. you improve their likelihood that they're going to benefit. And especially when you're doing expensive regenerative therapies,
sure,
you want to make sure everybody wants that to work.
Of course.
Right? Nobody wants that to fail. So I would make sure that anybody who's listening, if you're thinking about stem cell therapy, plasma-rich platelet therapy, talk to the person that's going to be providing those therapies to say, hey, is there a metabolic workup you want to do? Are there certain nutritional things that I need to work on? Do I need to change any dietary habits before doing this? And if they can't give you, good guidance there, you should find a practitioner that actually can look at that whole picture for you.
Sure. And that kind of reminds me of surgery. Like anytime I go for a surgery, I really plan ahead. Like I look at it as a marathon. If someone's going to cut me open, which I rarely want them to, then all of a sudden I make sure I have walked in so healthy. My metabolism's on point. I'm at my absolute healthiest, most vibrant self. Okay, now let's go for this. Because now you have the best chance of having a great outcome and a great recovery.
Absolutely. You really, and that's one of the things where you're setting up your resiliency. You're shoring up your nutritional status. And, I did a talk for a podiatry group at one point in New Jersey. And I made a comment that didn't sit well with the podiatrists at the time, because obviously they do surgery and they have their focus. But I brought up that we take people that are nutritionally deficient, that have poor functional status, that have a lot of oxidative stress, their joints are breaking down, they're degenerated, and then we cut them open, we create more trauma,
sure,
and then we expect them to heal.
Right.
And we should be doing it the other way around, where
Sure.
we should be shoring people's diets up, making sure their amino acid status is optimized. Right. Are they getting adequate protein so they can heal?
Yeah.
And are they can we get their sleep patterns a little bit more improved so they can recover better? And if we do these things in pain management, even in traditional pain management, our outcomes would be so much better.
Of course. So is there anything else you want to share today? Because I feel like you and I could talk for hours on this topic. We could keep going, but I know that we're running out of time today. So is there anything else you'd like to share today, or anything else you'd like for the audience to know about today?
Well, first, this has been an amazing podcast with you today, and I really appreciate the conversation. One of the things I really want to point out is that we've really had a disruptor recently, right? The COVID-19 pandemic has really disrupted the world, right? And I think in many ways what it did is it showed that the United States in particular, why did we have so many mortalities compared to other countries, right? We had so many mortalities because a lot of us are very chronically inflamed, right? And one of the challenges with chronic inflammation is it's not flagging on traditional tests, folks. You got to really know what you need to look at, and you got to look for nuances. You got to be able to look at kind of reference ranges, keeping in mind that you are an individual and that your number may be abnormal, even though it's in normal range. Right?
Exactly.
So what I would say with that is, if you can really start studying things about inflammation and really looking to improve every facet that you can to slowly but surely decrease your inflammatory sources, right? For women, for instance, more than one drink in a given day of alcohol, probably going to make you inflamed the next day.
Sure.
Can you have one drink? You likely can. Are you taking enough antioxidants? Are you actually exercising in a productive way? And in doing that, you can slowly but surely kind of identify, okay, wait a minute, these things are actually making me inflamed. And then just making small, subtle changes in the lifestyle. They don't have to be overt and dramatic. And I recommend they often aren't.
Sure. They're
subtle and they're purposeful. And then longitudinally, what ends up happening by attrition is you end up feeling so much better. So I just encourage people to really I appreciate inflammation as the driving source for a lot of issues, even mental health. And I'll leave on this final point of there's a very innovative thing we're doing now at the Marcus Institute where there's been evidence of using ultrasound-guided stellate ganglion blocks for PTSD. And this was actually research that was done by Dr. Mulvaney, who was a Navy SEAL that ended up becoming a neurosurgeon. And he ended up finding out that if you block that sympathetic nervous system or that chain in the cervical area, that people's PTSD was actually improving.
Wow.
So it's actually one of the things that really is going to be more and more popular as time goes on, and we're actually having a lot of people from around the country that are interested in this now. So
awesome.
Something I encourage people to look into is that having an interventional approach for PTSD as a obviously as part of a more comprehensive program can be really helpful. So I just wanted to kind of leave with that note.
Yeah, that's amazing. And one final question, just because I am the turmeric girl and it's what I'm known for. How do you approach using turmeric with your patients? Have you used inflammation relief with any clients or any people you know personally? I think you said your wife took it.
Yes. So turmeric has so many benefits, and I don't need to tell you what the benefits are. But one of the things that I'm very interested in as it relates to turmeric is if somebody is having increased GI permeability, which a lot of us do because we're chronically stressed, processed food sensitivities. Turmeric actually is very helpful with sealing up the permeability.
Yeah.
Which is fantastic. So I look for that opportunity in using turmeric for that. I use that as kind of a baseline fundamental anti-inflammatory. And I do, and you always want to make sure that the product that you're using is highly bioavailable. So the way that you formulate your supplements, you're doing it in a way that it's bioavailable, so people are getting what they think they're getting, right? So that's one of the things I do is I educate, make sure that people, if they're not using your product, that I review it and make sure that it at least has the bioavailability it needs, and then just putting that as part of a comprehensive program, good dietary plans, healthy lifestyle, clean air, clean water, clean food, and people tend to do pretty well.
Absolutely. Thank you. Thanks for sharing that.
My pleasure.
I have learned so much today, like I always do when I talk to you. My brain has all these words floating in it, like autophagy, cellular senescence, and all the other things we talked about, and the power of fasting, the power of customizing our care plan for ourselves based on our own genetics, based on our own body's needs. We've covered so many great topics today. So thank you so much for joining me on the podcast. If people want to find you, what's the best website or location to come find you?
So you can find me at FAU Medicine, the Marcus Institute of Integrative Health, and Florida Atlantic University.
Awesome. Thank you. Thanks for coming on the podcast today.
My pleasure. Thank you so much again.
Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health podcast this week. You have the power to transform your health and achieve vibrant health starting today.